My name is Kadden also, and I'm 13 years old. My parents told me I was diagnosed with sickle cell disease when I was 4 months old.
I felt terrible because we have a long history of sickle cell in our family. We all felt that once you are diagnosed with sickle cell, it becomes a death warrant. I started reading extensively about the disease and what interventions were available. And so even though I was apprehensive, I also knew that somewhere along the line, he would also be one of the success stories of a well-managed sickle cell condition.
Well, sickle cell disease is a genetic condition. And what essentially happens in sickle cell disease is that there is a problem with a component of the hemoglobin. So hemoglobins are proteins that form the red blood cell. In sickle cell disease, that hemoglobin is not properly formed. So a sickled hemoglobin is not able to transport oxygen efficiently. But number two, a sickled hemoglobin also gets destroyed very fast. A normal hemoglobin usually is what we call biconcave, almost an oval-shaped red blood cells, okay? When you have a sickled hemoglobin, their shape changes. They become crescent-shaped, almost like a letter C. For one to be able to manifest symptoms of sickle cell disease, you must get both the gene from the father and the mother. So you must have the two genes. If you only have one, you don't manifest symptoms. So the people will have one gene of the people we call carriers. They don't manifest symptoms.
Why newborn screening is very important is that newborn screening will enable you to identify this baby within that opportunity window of the first 4 to 5 months of life, before the clinical challenges start setting in. And usually newborn screening begins from birth. Actually, the real time of newborn screening should be at birth or the first few weeks of life. That's when we really call it newborn screening. Every child needs to be screened for sickle cell within their first few months of life. If we intervene in that window, we can turn around the outcomes drastically.
Sickle cell disease can actually cause lots and lots of complications. Some of them are acute, some of them are chronic. And these complications are really in the entire body. All the organ systems of the body can have complications. It is very important that patients with sickle cell disease are put on a regular follow-up program right from the time they are screened as newborns, and they need to be on comprehensive care. Now, this comprehensive care comprises of several things. One of them is parental education, where we educate the parents on really what sickle cell disease is about, how does one acquire it. But we also educate them on how to take care of a child with sickle cell disease. We educate them on what triggers a crisis and how to prevent that. And when they get about 9 months of age, we want to start them on a drug called hydroxyurea, which is a very useful drug for reducing crises. It's a drug that helps them to develop what we call fetal hemoglobin that is more efficient in transporting oxygen. And basically, patients on the hydroxyurea seems to have a fairly comfortable quality of life moving forward.
Being on SCD treatment has helped me go to school for a full term so that I don't miss any classes. I can also be active with my friends now because I can play with them without having to worry about getting sick.
Putting him on the treatment helped us a lot. If we hadn't opted to go for medical attention and treatment, I'm not sure he would have survived. I would want us to have a policy where every child at birth is screened for sickle cell. Because when you know the condition of the child, you are able to start treatment and management.
I would love to appeal to every parent that they should take their children to hospitals at a very young age. That can help them assess whether they are SCDs or not, which can also get them better health care if they are SCDs. I'll use myself as an example. because when my parents found out I was an SCD, they got me good medical care and attention, and that has helped me live a healthy life.